Hello, my name is Kayla Bordelon. I'm going to be talking to you about standards on human relations. On Section 3.01, we will discuss unfair discrimination. In work-related experience, psychologists do not engage in unfair discrimination. This means that psychologists do not discriminate against age, identity, race, sexual orientation, and religion. This falls under the general principle E, respect for people's rights and dignity. Psychologists work hard to ensure that judgments made are for the good of people and organizations that they work with. Under Section 3.01, psychologists must be able to make sound judgment and precautions to make sure their work does not reflect personal biases or prejudice. This falls under Principle D, justice. Standard 3.01 forbids psychologists from discriminating among individuals prescribed by law. For example, industrial psychologists need to be aware of non-discrimination laws relevant to race, religion, and disabilities that apply to the companies in which they work for. In Section 3.02, sexual harassment is sexual solicitation, physical advances, or it can be verbal or nonverbal conduct that is connected with duties of being a psychologist. Laws on sexual harassment vary and change over time. Standard 3.02 provides a clear definition of behaviors that are prohibited and considered sexual harassment under the Ethics Code. To meet the qualifications for sexual harassment, it needs to be extremely severe or intense that a person would feel violated and find it abusive after it has been brought to the psychologist's attention, which would then create an unwelcomed, hostile workplace. Standard 3.03 is other harassment. A psychologist does not engage in any behavior that is demeaning or harassing to any person with whom they interact with. This also falls under Principle E. Standard 3.03 forbids behaviors that harass or demean those individuals with whom psychologists interact with. Avoiding harm is Standard 3.04, which falls under Principle A. This is the psychologist's duty to make sure that harm is avoided or minimized when conflict arises. Harm is not always unethical or avoidable. For example, giving low grades to those who perform poorly on exams, or disclosing information to protect the physical welfare of a third party. After recognizing certain harms are unavoidable, psychologists then take steps to avoid harming those they work with in their professional environment. These steps do comply with other standards in the Ethics Code. Aversion therapy involves repeated association of a maladaptive behavior or cognition with an aversive stimulus such as nausea. This is to get rid of the pleasure associated with the behavior by giving the person a negative response. Aversion therapies have been proved to work with certain treatments such as nicotine cravings. Even with the evidence of clinically being effective, aversion therapies will continue to require ethical deliberation because it purposely causes distress to clients and patients. Violations of Standard 3.04. When health maintenance organizations refuse to comply with psychologists' requests to extend coverage for clients or patients, psychologists can be at risk for violations of Standard 3.04. This is because either the psychologist did not take the steps needed to communicate with the client and insurance company for the number of sessions needed for therapy, or they did recognize the need for continuing treatment but did not communicate in a timely manner with the insurance company. Psychotherapy and counseling harms. Harmful psychotherapies are defined as those that produce outcomes worse than what would have occurred without treatment. Psychologists should be aware of psychotherapies or counseling techniques that may cause harm to clients or patients. If the treatment is strong enough to improve mental health, it can also be equally effective in worsening it. If the treatment fails, psychologists will seek other techniques, offer consulting, or give a referral for appropriate counseling. Harmful effects are easiest to detect for mental health problems whose natural course is constant. In these circumstances, when the psychologist is aware that continuing a certain treatment is harmful to the patient and does not stop them, they can be at risk for violation of Standard 3.04. The questions of whether or not the trial is effective for randomized clinical trials for mental health, these treatments are raised by their very nature. This is the possibility of a failure to respond to an experimental treatment or decline in mental health while the trial is taking place. To comply with Standard 3.04, research psychologists should develop procedures to identify and address such possibilities. For example, scientifically and clinically informed inclusion and exclusion for patient participation. Thanks for listening. This was my sections of Human Relations Standards 3.01 to 3.04.